Vitamin B12 deficiency after 60. 7 signs often mistaken for aging. Memory cluster. You stand up, take a few steps, and something feels slightly off. Your feet tingle. Your balance is not as steady as it used to be. You feel tired even after sleeping. Then you lose the thread of a conversation and wonder whether this is simply what getting older feels like. Sometimes it is not one problem at all. It is a pattern. Vitamin B12 deficiency can affect the blood, the nerves, balance, mood, memory, and even the mouth. Because those changes may build slowly and appear in different parts of the body, they are often treated as separate signs of aging. In this video, we will look at 7 signs of vitamin B12 deficiency that deserve attention after 60, especially when several appear together. We will also explain why the usual picture of anemia can be misleading, who is more likely to have trouble absorbing B12, and why one blood result does not always settle the question. The point is not to blame every memory lapse, tired day, or unsteady step on one vitamin. It is to recognize when a group of symptoms may deserve a closer look. Vitamin B12 helps the body make healthy red blood cells, supports DNA synthesis, and helps maintain normal nerve function. The body can store a large supply of B12, sometimes enough to last for years. That sounds reassuring, but it creates a strange problem. Deficiency can develop quietly. A person may be eating less, absorbing less, or losing the ability to use B12 long before the full pattern becomes obvious. And here is the fact that changes how this topic should be understood. Neurological symptoms can appear without anemia. In other words, numbness, tingling, balance changes, or cognitive difficulty may begin even when a routine blood count does not show the textbook picture many people expect. This is not a diagnosis, of course. It is information worth bringing to your next appointment if the pattern sounds familiar. The first sign is fatigue that feels out of proportion to your day. You may notice that stairs take more effort, simple chores leave you drained, or your body feels weaker even after a normal night of sleep. When B12 deficiency interferes with red blood cell production, the cells can become abnormally large and less effective. Doctors call this megaloblastic anemia. That means the blood may not carry oxygen as efficiently, which can lead to fatigue, weakness, shortness of breath, or a faster heartbeat. But fatigue by itself tells us very little. Poor sleep, thyroid disease, infection, depression, heart or lung problems, pain, and many other conditions can cause the same thing. The useful clue is the combination. Fatigue becomes more meaningful when it appears with tingling, an unsteady walk, a sore tongue, or mental fog. One symptom can be vague. A pattern is harder to dismiss. The second sign is a change in sensation, often in the feet, hands, or lower legs. Some people describe pins and needles. Others notice numbness, burning, buzzing, or an electric feeling. The floor may feel less distinct under the feet. Fine movements can become less precise. Vitamin B12 is important for myelin, the protective covering around nerves. When deficiency affects the nervous system, those signals may not travel normally. This is where the topic becomes easy to misunderstand. Tingling is often blamed on circulation, diabetes, a back problem, or normal aging. Those are all possible explanations. B12 deficiency is simply another possibility that belongs on the list. And again, nerve symptoms can occur without anemia. That matters because a normal-looking blood count can create false reassurance while neurological symptoms are already developing. Not every case of neuropathy comes from B12. But new, persistent, or progressive sensory changes should not automatically be accepted as an unavoidable part of getting older. The third sign is a change in walking or balance. Balance is not just about muscle strength. Your brain must constantly receive information from your eyes, your inner ear, your joints, and the nerves in your feet and legs. One part of that system is called proprioception. That is simply your body's sense of where it is in space. When B12 deficiency affects the nerves or the spinal cord, that position sense can become less reliable. You may hesitate on stairs, feel less steady in the dark, widen your stance, or reach for furniture more often than you realize. An unsteady walk is often blamed on weak legs. But if the feet are not sending clear information to the brain, strength exercises alone may not explain the whole problem. The combination matters again. Balance difficulty plus numbness, tingling, fatigue, or mental fog creates a more specific picture than balance trouble alone. Sudden imbalance, new weakness, difficulty speaking, or a sudden change in walking is different. Those symptoms can signal an urgent neurological problem and require prompt medical assessment. The fourth sign is the one that creates the most fear. You may lose the thread of a conversation, need more time to follow instructions, forget a recent detail, or feel that your thinking is slower than usual. Vitamin B12 deficiency can cause cognitive symptoms in some people, including problems with concentration, short-term memory, confusion, and brain fog. But this is where careful wording matters. B12 deficiency is not the cause of most dementia. Studies have not shown that low B12 alone explains most cases of long-term cognitive decline, and supplements have not been proven to reverse established dementia in people who are not deficient. That does not make genuine deficiency unimportant. It means the diagnosis has to be specific. The more useful question is not, does every memory problem come from B12? It is, do the memory changes appear alongside numbness, balance problems, fatigue, or risk factors for poor absorption? That is the kind of pattern that gives a physician a reason to investigate. The fifth sign is a change in mood. Depression, anxiety, irritability, and other mental health symptoms have been reported with B12 deficiency. But mood changes are among the least specific clues in this entire video. Grief, isolation, pain, poor sleep, chronic illness, medication effects, and life stress can all affect mood. A person should never assume that anxiety or depression proves a vitamin deficiency. Still, mood changes can make sense as part of a larger pattern. A new decline in mood that appears together with fatigue, tingling, balance difficulty, or cognitive fog deserves a broader look. The brain does not divide mood, attention, and sensation into neat boxes. One problem in the nervous system can sometimes affect several functions at once. That is why this video is not really about 7 separate symptoms. It is about whether those symptoms begin to connect. The sixth sign is the traditional picture many people associate with B12 deficiency. If megaloblastic anemia develops, the skin may look pale. Modest activity may cause unusual breathlessness. The heart may beat faster to compensate for reduced oxygen delivery. Weakness, dizziness, and reduced exercise tolerance may appear as well. In some cases, the skin or the whites of the eyes may take on a faint yellow tint as abnormal red blood cells break down. These signs matter, but their absence does not clear B12 from the list. That is the central correction in this video. The nervous system can be affected before anemia becomes obvious, and some people never show the classic blood picture at all. Shortness of breath, chest discomfort, fainting, or a new rapid heartbeat should not be assumed to come from a vitamin problem. Those symptoms can have serious cardiac or pulmonary causes and need proper evaluation. The seventh sign comes from a place many people would never connect with memory or balance: the mouth. Vitamin B12 deficiency can cause glossitis, an inflamed tongue that may look red, smooth, swollen, or sore. Some people notice burning in the mouth, taste changes, or discomfort while eating. Reduced appetite and weight loss can also occur, although those signs are less specific. Dental problems, gastrointestinal disease, infection, and medication side effects can produce similar changes. What makes this clue useful is not the tongue by itself. A sore, smooth tongue, together with fatigue, numbness, or balance problems, creates a pattern that is difficult to explain as ordinary aging alone. The body does not suddenly need more B12 at 60. The bigger issue is often absorption. Vitamin B12 in food is attached to protein. Stomach acid and digestive enzymes help release it. The vitamin then binds to intrinsic factor, a protein made in the stomach, before it can be absorbed in the final part of the small intestine, called the terminal ileum. You do not need to remember every step. The practical point is simple. A person can eat enough B12 and still fail to absorb it properly. Atrophic gastritis becomes more common with age and can reduce stomach acid. Autoimmune gastritis can damage the stomach cells that make acid and intrinsic factor. Long-term metformin use can lower B12 levels in some people. Proton-pump inhibitors and H2 blockers, used for acid reflux and related conditions, can interfere with the release of B12 from food in some long-term users. Gastrointestinal surgery, bariatric procedures, Crohn's disease involving the terminal ileum, celiac disease, and strict vegan or highly restricted diets can also raise risk. Repeated or recreational nitrous oxide exposure is another important risk because it can interfere with B12 function and damage the nervous system. None of this means a viewer should stop metformin, acid reflux treatment, or any prescribed medicine. The relevant question is whether symptoms, medications, diet, and medical history together justify testing. The first test is usually a total serum B12 level, or, in some settings, active B12. But the result is not always a simple yes or no. Laboratory cutoffs vary. A value near the borderline may not tell the whole story, especially when symptoms are convincing. That is where methylmalonic acid, usually called MMA, may help. MMA can rise when cells are not getting enough usable B12, so it can provide more information when the first result is uncertain. MMA is not perfect. Kidney impairment and age can affect the result, which is why it must be interpreted in context. Homocysteine may also rise with B12 deficiency, but it is less specific because folate status, kidney function, and other factors can influence it. The important takeaway is not the name of every test. It is that one borderline number, or the absence of anemia, does not always settle the question. Confirmed B12 deficiency is treatable. Treatment may involve prescribed oral B12 or intramuscular injections, depending on the cause, severity, symptoms, and the person's ability to absorb the vitamin. Some people with autoimmune gastritis, total gastrectomy, or complete terminal ileal resection may need lifelong replacement. Symptoms may begin to improve within weeks, but neurological recovery can take much longer. When nerve damage has been present for a long time, recovery may be incomplete. That is why early recognition matters. At the same time, B12 is not a general memory supplement for everyone over 60. Trials in people without overt deficiency have not shown a reliable cognitive benefit. Your clinician knows your health history, medications, kidney function, diet, and risk factors, so involve them before starting treatment or changing anything. Vitamin B12 deficiency does not usually announce itself with one unmistakable sign. It may look like tiredness, tingling, slower thinking, a change in balance, a low mood, a pale appearance, or a sore tongue. Any one of those symptoms can have many causes. What deserves attention is the pattern. When several signs appear together, especially in someone with risk factors for poor absorption, the changes should not automatically be dismissed as aging. The clearest message is this: neurological symptoms can occur without anemia, confirmed deficiency is treatable, and early evaluation matters. Memory changes after 60 should not automatically be called dementia. In the next video, we will look at the differences between ordinary forgetfulness and patterns that deserve a closer evaluation.